The Northern Territory is just weeks away from winding back some border controls, and many of its most vulnerable are still unprotected.
This is getting to the point of being serious.
In some remote communities, fewer than 10% of people are fully vaccinated, but the government says the reopening roadmap can't wait forever.
It's not a matter of if, it's a matter of when. This virus is absolutely coming to the Northern Territory.
The peak body for the NT's Aboriginal community-controlled health services says over the next 6 weeks, urgent effort is needed to boost vaccination rates.
If we're not prepared, then, particularly in our most vulnerable communities and those remote communities, it'll have a devastating impact.
And if rates don't improve, plans to further ease border controls must be delayed.
If we aren't getting the vaccination percentages up, then we may have to seriously consider pushing back the timeline.
Congress in Alice Springs now has extra federal funding to run an 8-week vaccination blitz, which will see health workers and community leaders going door to door talking about vaccines.
It's going to require that kind of intensive engagement. Expecting people to just come into the clinic and have their vaccine is not going to address, is not the way that's going to address the current vaccine hesitancy.
Chief Minister Michael Gunner says the vaccination rate in most Aboriginal communities in the NT is excellent, although he admits the rate is worryingly low in some. He says everyone will be offered the chance to be vaccinated, but he can't force needles into arms.
The vaccination rate in Darwin has been consistently higher than the rest of the territory.
So 93% of our staff have double vaccinated and the remaining 7% have only had their first dose.
The capital's Aboriginal Health Service is pulling data to confirm how many of their 9,000 clients are protected, but say early results look good.
We've just done some data cleansing work on people aged 55 and over, and it looks like from our client numbers, about 85 to 90% of those clients are vaccinated.
The desperate hope is that those who've fallen behind can catch up before COVID catches them. Lauren Roberts, ABC News, Darwin.